Guys, can you hear me now? Oh, awesome. So you can hear me. Oh, good. I don't know what's going on with my computer. All right. So you can hear me. All right. So let's see if we can get the screen up. All right. Perfect. We're in business. So you guys can hear me and you can see. All right. Awesome. All right. Good. All right, guys. So tonight, not too long. I'm not going to keep you too long tonight because heart blocks, they're only 4. Yeah. The weather. Yeah. Bad weather. Okay. So only 4 heart blocks. So I'm not going to keep you long, but I think you'll really understand it a lot better. Okay. You'll understand it. You'll understand the interventions. You'll understand the treatment. Okay. So the disclaimer, the views, thoughts, and opinions expressed in the text belong solely to the author and not necessarily to the author's employer, organization, committee, or other group or individuals. All right. And the second disclaimer is federal law allows citizens to reproduce, distribute, or exhibit portions of copyrighted motion pictures, videotapes, or video disc under certain circumstances without authorization of the copyright holder. All right. This is called for fair use and is allowed for purposes of criticism, news reporting, teaching, and parody, which doesn't infringe of copyright under 17 USC 107. All right, guys. So heart blocks. So these are the major heart blocks that you guys will have to know as a first year nurse. Okay. We talked about normal sinus rhythm maybe a week ago. And first degree heart block is new. You have to know about a first degree heart block. You have to know about second degree heart block type 1. And then there's a second degree heart block type 2. And there's a third degree heart block. So we have our normal sinus rhythm, which is what we want. Okay. A patient may have a first degree heart block. All right. The one thing we talked about this, we talked about the PR interval. We want, ideally for a normal sinus rhythm, we want the PR interval to be, less than or equal to 20 seconds. But for the first degree heart block, you're going to find that PR interval is longer. The second degree heart block type 1, progressive prolongation of PR interval until the QRS drops. So for a second degree heart block type 1, is going to, the PR interval is longer, and then the QRS is going to drop. And then for a second degree heart block type 2, there's a constant PR interval, and then the QRS just drops. No warning, nothing. This patient needs a pacemaker. And then you have a third degree heart block, complete disruption of AV conduction. The P wave and the QRS, they do not align at all. So this patient needs a pacemaker. So we have our normal sinus rhythm, which we want, is ideal. We have a first degree heart block. You're going to see long PR interval. Then you have a second degree heart block, type 1, progressive prolongation of the PR interval. Long. Then the QRS is going to drop. Now, for the second degree heart block type 2, there's a constant PR interval, but guess what? The heartbeat drops also, but no warning. And then you have your third degree, the P and the QRS, they don't coincide. They're disassociated. So remember these 4. All right. We have our first degree, second degree type 1, second degree type 2, and then third degree. All right, so we have our normal sinus rhythm here. We have our beautiful P wave, PR interval. Look at that beautiful PR interval, guys. It's exactly where I needed to be. And then you have the QRS. All right. And then you have the ST segment. And then you have the T. So you have the atrial depolarization, atrial systole, ventricular depolarization, ventricular systole, ventricular repolarization. That's how it's supposed to be. All right. Normal sinus rhythm, a normal sinus rhythm. This is what we want. This is how it's supposed to look. Okay. In an ideal world, in a theoretical world. So if I have a first degree heart block, all right, if the R is far from the P, then you have a first degree. If the R is far from the P, then you have a first degree. So I want you guys to find that R, that spike, that's the R, and find the P. All right, look at the R. There's an R there. And then that P wave. That's the R. Then the P. If the R is far from the P, then you have a first degree. If the R is far from the P, then you have a first degree. The R is far from the P. Then you have a first degree. We know that our PR interval should be perfect. We know that it's a measured. So when the R is far from the P, then you know you have a first degree. So the etiology often is basically benign, guys. It's a delay of impulses through the AV node, a longer PR interval. If the R is far from the P, you know you have a first degree. There's a longer PR interval. But there's always a P wave. This is often benign. It's just a delay of impulse through the AV node. All right. This comes from like structural abnormalities, maybe increased vagal tone. Medications like digoxin, beta blockers, calcium channel blockers can cause this. All right. So first degree heart block, guys, often does not cause symptoms. And it may be detected. All right. First degree heart block. It often does not cause symptoms. It may be detected during a routine ECG, but the patient heart rate and rhythm are usually normal. All right. So here you go. Here's the first slide, Giovanna. If the R is far from the P, just know that you have a first degree. You see the R and the P? If that interval, you see how there's a PR interval, guys? You're welcome. If the R is far from the P, then you have a first degree. You see the PR interval? If the R is far from that P, then you know that you have a first degree. So the PR interval in this case, guys, is greater than 20 seconds. That's a problem. All right. The PR interval is greater than 20 seconds. That's a problem for us. All right. So, you know, if the R is far from the P, then you have the first degree. But this one is what? That patient is non-symptomatic. It may be caused by structural abnormalities, increased vagal tone, medication, drugs. All right. So that's your first degree. All right. So let's take a look at it again. If you have a first degree, If the R is far from that P, look at that PR interval. If that R is far from the P, then you have a first degree. All right. So that's how you know you have a first degree. The P and the R, that is prolonged. The PR interval is greater than 20 seconds. All right. Remember, that patient is non-symptomatic. It may be caused from drugs. It's maybe structural abnormalities from the patient. The patient is usually non-symptomatic. All right. So now we go to second degree heart block, type 1. Second degree heart block, type 1. So this patient is going to have a prolonged PR interval until, there's an issue now. The QRS drops. So a prolonged PR interval until the QRS just drops off. So this is our first degree heart block. All right. I'm sorry. This is our second degree heart block, type 1. I'm sorry, guys. Second degree. There's an issue here because the QRS drops. Now, for the first degree heart block, did the QRS drop? For the first degree, did the Q? It didn't drop. What do you guys think? That first degree, it didn't drop. The QRS didn't drop. It was just the P and the R, they were just, it's greater. That PR interval was just increased. Non-symptomatic, go on about your life. They usually find it on the EKG. Now, this person has a second degree heart block, type 1. So there's an issue now. All right. There's an issue. Prolong PR interval until the QRS drops now. All right. The QRS drops. So there's an issue. So how can I remember this second degree heart block, type 1? How can I remember this? Longer drop, then you have a Winky Bach. That's a Mobiz type 1. So when that PR interval, guys, it gets longer and longer and longer. And then guess what? A drop. Then you have a Winky Bach. That's the Mobiz type 1. So the PR interval gets longer and longer and longer. And then the QRS drops. Now you have a Winky Bach. So let's look at something here. Let's look at a perfect example. The PR interval. Guess what, guys? It's going to get longer. Then the QRS is going to drop. Then you have a Winky Bach. That's a Mobiz type 1. The PR interval, guys, is just going to get longer and longer. Then it's going to drop. And that QRS is going to drop. So that's how you know that you have a Winky Bach. So let's look at it again. All right. The PR interval is just going to get longer, then drops. The QRS is going to drop. That's how you know you have a Winky Bach. That's a Mobiz type 1. So a Winky Bach can be a problem, guys. All right. The QRS drops in a repeating pattern. All right. The PR interval will just get longer and longer. And then that QRS is going to drop. This patient is going to have a Winky Bach. So let's look at it again. We want a perfect PR interval. We want a perfect PR interval. So look at the PR interval. This thing will just get longer and longer and longer until the QRS is going to eventually do what, guys? What's going to happen to the QRS? It's going to drop. Is the PR interval will get longer, 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 and then the QRS will eventually do what? And then you have a winky Bach. Okay, so that's the Mobiz type 1. So just take a look at it here. You can see it better here on this one. The PR interval will get longer. You'll see the PR interval. It's going to get longer, 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 and then the QRS will eventually drop. So then you know that you have a winky Bach. You see that how the QRS is gone? So when you measure that QR interval with a caliber, guys, it's going to get, the PR interval will get longer, 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 and then the QRS will just drop. So that's how you know you have a winky Bach. So this is another, that's our second degree heart block type 1. All right, that's our second degree. So this is an even better picture here. So let's see if we can get it on this one. You guys can really see this one that's coming up. All right. So you guys, you can kind of see, you'll see how the PR interval, look, it's going to get, that's the PR interval there. And then it's going to get longer. You see how that PR interval is longer, 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 and then it will eventually drop. And now then you have a winky Bach. So a Mobiz type 1. So longer, 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 longer drop, and then you have a winky Bach. So longer, longer, and then drop. The QRS is gone. Then you have a winky Bach. Mobiz type 1. All right. So basically what happens, guys, is this is the Mobiz type 1. This is the second degree Mobiz type 1. So the PR interval, it will eventually get longer and longer and longer. And then that QRS complex, it will just disappear. It's going to drop. And that's how you know you have a winking Bach. Okay. So you got your first degree. All right. And then you have your second degree type 1. Now we're in the second degree heart block Mobiz type 2. So 2 second degrees, Mobiz type 2. This guy is unpredictable. There's no change in the PR interval. There's no warning. So remember how we were saying longer, longer, longer drop? Well, this thing, the QRS just drops from this one. So this one is dangerous. Okay. This one is dangerous. So this one, the patient needs a pacemaker because it just stops. The QRS just completely stops. There's no warning. There's no warning for a second degree heart block, Mobiz 2. There's no warning. There's no longer drop. No. There's a constant PR interval. And then it just drops. There's no longer PR interval. The PR interval for this guy is perfect. But the QRS, it just drops. So let's take a look. This is a second degree heart block type 2. This is a Mobiz 2. So you guys can see the P wave here. P wave, P wave, P wave, P wave. QRS, it just drops. All right, so let's do it again. You have the P wave. You see the P wave? All right, let's look at the PR interval. You see it's fixed. It's perfect. The PR interval is perfect. And then you have the QRS. Then if you go over here, you have a fixed PR interval. You see the PR, it's a fixed PR interval. Then you have the QRS. You go over here. There's another fixed PR interval. You have your QRS. And then look at this P wave here with a dropped QRS complex. Just out of nowhere, guys. Out of nowhere, the QRS drop. So it's not like long. No, the QRS just drops. All right. It says if some P's don't get through, then you have a Mobiz 2. That P wave did not get through, guys. You have a drop QRS complex. This is a Mobiz type 2. So let's look at another one. Just remember for this one, if some P waves don't get through, then you have a Mobiz 2. All right. So we have a beautiful PR. It's a fixed PR interval here. A fixed PR interval. You see the fixed PR interval. No issues here. And then, you know, the P wave doesn't go through because you don't have the QRS. There's no QRS. It just dropped. Look at this one, guys. Look at the Mobiz 2. So the Mobiz 2, guys, is the dangerous one. Okay. This is the one that the patient needs a pacemaker. The Mobiz 2, because at least with the Mobiz, the type 2, Mobiz 1, at least there's some type of warning sign. Longer drop. Then you have a winky box. Then they say, okay, we can kind of gauge that. We can kind of take care of this patient. But for someone that has a Mobiz type 2, guys, a Mobiz 2, then this is very unpredictable. This is very unpredictable. And the last thing that you want is any type of, you never want to have anything unpredictable about your heartbeat, ever. Cardiologists can work with, okay, longer drop, longer drop. They know that's going to happen. But for the Mobiz, it's no type of warning. The QRS, it just stops. Your heart just stops. It skips a beat. So would you feel comfortable letting your family member walk out the door knowing that they can skip a beat at any time? So this is the one, guys, that the patient is going to have to get a pacemaker. It's unpredictable. All right. It's unstable. So Mobiz type 2, the patient needs a pacemaker. The QRS just drops. There's no longer. No, everything can be going fine. And then the QRS, it just disappears. It just drops. All right. So make sure that you guys understand that etiology, guys, is an abnormal heart rhythm, cardiac arrhythmia. All right. This is an abnormal heart rhythm, cardiac arrhythmia. Expected findings. Look at the expected findings, guys, for the Mobiz type 2. Look at the expected findings. Dizziness, confusion, breathlessness. This patient is in bad shape. So this patient is going to need a pacemaker, guys. So it's unpredictable. The Mobiz type 2 is a higher degree. So this one has to have intervention. It has to have some type of treatment. So because there's no change in the PR interval, there's no warning sign. The QRS complex are dropped. So this patient has to have a pacemaker. This is a definite indication for a pacemaker. All right, because there's no warning. No cardiologist is going to let someone out the door like this with the QRS complex just dropping. So they're going to make sure that this patient has to get a pacemaker. So this is a picture of a pacemaker, guys. This is the first time you guys will see it. This patient needs a pacemaker because the QRS, it just drops. There's no warning, nothing. All right. So this patient is a candidate for a pacemaker. All right. And so here it is again, guys. If some P's don't get through, then you have a Mobiz 2. All right. This is a second degree heart block type 2. The issue here is the PR interval, guys. Look at the PR interval. The PR interval is constant. There's a constant PR interval. And then the QRS just drops. So the cardiologist is going to have to treat this a little more aggressively. The patient does have signs and symptoms. The patient has shortness of breath. The patient experiences confusion. So this patient has to get a pacemaker. All right. So always remember second degree heart block type 2. Constant PR interval. The QRS just drops off. All right. And that's the problem. So this patient is definitely going to get a pacemaker. And then for our very last block, complete AV block. AV disassociation, guys. This is a complete disruption of AV conduction. Complete disruption of AV conduction. All right. So the etiology of this, guys, is organic heart disease, myocardial infarctions, electrolyte imbalances, and coronary ischemia. So organic heart diseases, myocardial infarctions, electrolyte imbalances, and coronary ischemias can cause a third degree heart block. So what can you expect the patient? How is the patient going to present? Okay, the patient is going to be very dizzy, extreme dizziness, hypotension. The patient may faint, altered mental status, and hemodynamic instability, guys. So, this is a third degree heart block, complete disruption of AV conduction, complete. All right. So just take a look at this, guys. If P's and Q's don't agree, then you have a third degree. So if P's and the Q's don't agree, you have a third degree. The P waves are normal, but they're not related to the QRS. Yes, fatigue. Very tired, very pale because of the oxygenation. There's a decrease in cardiac output. Because the P waves and the Q don't agree, guys. The P waves and the QRS, they don't agree. So just take a look at this. Look at this image here. The P wave here, the P wave and the QRS, they do not agree. The P wave, and you see how it's supposed to be a perfect PR interval? Guess what? When you have a third degree heart block, that P wave and the Q, they do not agree. They don't align. The P and the Q, they're doing their own thing. All right. So this is look at the third degree heart block. I want you to remember P's and Q's don't agree. P's and Q's, they don't agree. All right. So now this patient has a third degree. All right. So this is a complete disruption of AV conduction. Complete disruption of AV conduction. So how do we treat this? Well, this patient is going to have atropine, guys, and this patient will definitely need a pacemaker. All right. The patient will be on atropine. The doctor will order atropine and a pacemaker for this patient. So this is the pacemaker that they're going to order for this patient because there's a complete disruption of AV conduction. All right, so let's go back real quick. Let's go back to the top. All right, so these are the heart blocks, guys. Remember, there's 4 heart blocks. There's a first degree heart blocks. The P wave is greater than 20 seconds. All right, P wave greater than 20 seconds. The PR interval is greater than 20 seconds. And then you have your second degree heart block type 1. There's a progressive prolongation of the PR interval until the QRS will just drop. All right, but there's a warning there. It's a progressive. All right. For the second degree heart block type 2, the constant PR interval. But what just drops with the second degree heart block? There's a constant PR interval, but what's the problem? What just drops all of a sudden out of nowhere? It's just without warning. What happens during the second degree heart block type 2? What just drops? What complex just drops? Go ahead and type it in the chat. The QRS complex just drops. So does this patient get a pacemaker? Do you think this patient needs a pacemaker? Would you feel comfortable just sending this patient home? All right. All right. And then you have your third degree. There's a complete disruption of the AV conduction. So tell me, what do they mean? Type it in the chat, guys. What do they mean by complete disruption of the AV conduction? What do they mean by that? What do they mean by complete disruption of the AV conduction? Type it in the chat. No electrical function. The P and the Q, they don't align. All right. So you see this here, the P, which is atrial depolarization and ventricular depolarization, it does not occur. The atrial depolarization and the ventricular depolarization, it is not happening. It does not occur. So that's why this patient has to have a pacemaker. Okay. All right. So remember, guys, so this is your quiz. I'm going to give you a quiz. All right. This is your quiz. First degree heart block. All right. You have second degree heart block type 1. You have second degree heart block type 2. You have third degree heart block. Which one, guys, do you know for certain that the patient needs a pacemaker? Which one you know for certain that the patient will get a pacemaker? You can type it in the chat. No, Jenny, it's not fibrillating. It's just not beating. The atrial depolarization and the ventricular depolarization isn't occurring. Second degree, which one? Type 1 or type 2? Who gets the pacemaker? Type 1 or type 2? Okay. Which one is the prognosis is poor? Is it the second degree heart block type 1 or is it second degree heart block type 2? Which one is prognosis is poor? Second degree heart block type 1 or second degree type 2? Very good. All right, type 2. So there's 2 second degrees, right? Second degree heart block type 1, second degree heart block type 2. Which one is more predictable? Which one is more predictable? There you go. 1, type 1. Okay. And third degree, guys, is a complete disruption of the AV conduction. So, guys, these are the heart blocks. Okay. So, what you have to do to get very comfortable with this, just go back, look at the video at least 2 more times, and then you'll be able to, like, you'll get a better idea. But these are the 4, guys. That's it. Don't go any deeper. Don't feel like you don't know it because you don't see it. This is it. These are the heart blocks. You have first degree heart block, you have second degree heart block type 1, you have second degree heart block type 2, and you have third degree heart block. Okay, and that's it. All right. The most confusing thing is like the first degree heart block is not even. Yes, I'll post a video. All right. The first degree heart block, the PR is greater than 20 seconds. All P waves are conducted. It's just the PR interval is longer than 20 seconds. And then you have 0.20 seconds. And then you have the second degree heart block type 1. It's a progressive prolongation of the PR interval until the QRS drops. And then the second degree heart block type 2, constant PR interval. But this thing is not predictable, guys. So the second degree heart block type 2 is so unpredictable. So this patient is going to get a pacemaker. And third degree heart block, there's a complete disruption of the AV conduction. The P wave and the Q wave, they're just doing their own thing. Okay? They're just doing their own thing. So there's definitely a pacemaker. And the last thing I want to tell you guys, you have a first degree heart block. They say it's like, think about a husband and a wife. Okay? The husband, guess what? He's a P wave, the PR interval. He just comes home late. First degree, he just comes home late. All right? And then the second degree heart block type 1, he comes home later. One night he'll come home at 9 o'clock. One night he'll come home at 9:30. One night he'll come home at 10. And then guess what? One night he doesn't come home at all. Then he'll start again. Come back at 9. He'll come back at 9:30. Come back at 10. And then guess what? He decides not to come home at all. All right. And then you have the second degree heart block type 2. Guess what? You don't know when he is, no pattern. He may come home late Tuesday. He may come home late Wednesday. He may come home late Friday. He may not come home the other days. You don't know what he's doing. You have no idea. Okay? There's not like a 9:30, 10 not come home. Okay? He may be on time every other night, and then all of a sudden, he's not going to come home. And then the third degree heart block, guess what? Now the wife is not coming home. So neither one of them, they never, one day she's not home, the other day he's not home. One day she doesn't come home, they're not, both of them are cheating now. Okay? The third degree, guess what? Nobody's coming home. Nobody's doing the right thing. They are on two different pages, both of them cheating now. All right? So that's how you remember your heart blocks, guys. And the one that's unpredictable, the one that you don't know when he's going to come home, guys, he needs a pacemaker. All right? The predictable one is number 1. There you go. So sometimes they'll tell you to remember the heart blocks from the husband. All right? And remember the third degree, both of them are cheating, the wife and the husband. Everyone's doing their own thing. Exactly. Look at Tangela like whoop whoop. All right. So go back, guys, and look at it. So however you have to, there's so many different ways to remember it, but these are the main ones. These are the heart blocks. Okay. Cheaters. When third degree, listen, she joined them, Tangela. She like, okay, so if you ain't gonna come home, then I'm not coming home either. You come home when you want to come, I'll come home when I want to come. All right. Third degree. It's over. You need a pacemaker. It's a wrap. All right. So look at the video again, guys. Look at the video again. And this is how you learn your heart blocks, okay? You're going to have to watch it a couple of times. All right. Yeah, because everybody can relate to that. All right. All right, guys. Good night. Now everybody's awake now, right? Everybody can relate to that. All right, guys. So good night. All right. And I'll see you guys on Friday. I think we have one more cardiovascular and then that's it. I think we're doing cardiovascular meds. So I'll see you Friday. Angela say you woke me up. All right. See you Friday, guys. Be good. Listen, I see her on Facebook showing out. Good night, guys. I see you, Miss Angela. All right, guys. See you Friday. Well, I'll see you guys on Tuesday. On Tuesday and Thursday. All right. See you tomorrow, Mr. Miko. See you Friday. Bye, guys. Good night.